have an opportunity to talk about a new initiative that they have with Dr. Rachel Rader. So, Lynn, welcome to the show today.
Thank you, David.
Tell us what's going on.
Well, first I have to say I thought I was going to be, this was a serious business show, and
we're serious.
We're very serious.
What I find out is like it's Louis Rukeyser meets Don Imus.
I think he just made fun of you, Wayne.
I was just going to say, did he make fun of us? I hope so.
He's got this show figured out already.
Just trying to get with it here.
Okay, you're doing a great job.
So hopefully a lot of folks are familiar with Thorlo. Actually, my grandparents started the company in 1953. At that point, it was called Thornburg Hosiery Mill. But the Thorlo of today has evolved quite a bit. And about 2002, with a little help from Thorlo, my father founded a not-for-profit called Institute for Preventive Foot Health. And the Institute, I'm the volunteer president of the Institute, and we're here to talk about an initiative that the Institute has locally today, and that's why Dr. Rader is involved. Just a little bit of background about the Institute. As I say, it was founded on basically on the heels of about 8 or 9 clinical research projects that were done about the fabric that Thorlo makes and puts into various sock products. And we found that this fabric reduced pressure, reduced friction and blisters, helped prevent pain and reduce pain for the arthritic foot, and it was particularly applicable to reduction in risk for ulceration in the diabetic foot. And so we've basically founded the Institute to have a not-for-profit format to provide education and awareness about all aspects, not just shoes and socks, but all aspects of taking proper care of your feet. And we've been at it for about 12 or 13 years now, and we've done a good job. If you go to our website at www.ipfh.org, you'll see a panoply of information about the foot and how to properly select and fit socks to shoes properly to protect your feet, all types of information about disease conditions of the foot and what you can do about those. And along with that, as we've built out the website, we also hired a full-time executive director who's a podorthist, and he goes around the country and does education talks with senior citizen groups and diabetic educators and doctors and physician conventions. And we just now, in the last couple of years, have started to try and use this platform that we really are not known for locally, but have kind of established this more of a regional and national footprint from the website and from all of our speeches and things that Bob has done around the country to try and bring that home to Statesville and Iredell County and surrounding areas. And last year we met Dr. Rader when we co-sponsored a foot health fair over at 5th Street Ministries. And we had a nice success over there and thought we wanted to expand this to make it open to the community wide. And so we partnered with Davis Hospital to do a foot health fair in April. And I'm going to introduce Dr. Rachel Rader to talk about that.
Okay, but before we introduce this lovely lady that you just brought the level of the studio up like times 10 by bringing her in there. You understand that, don't you? Nice job, Dave, with this one. Go back, give the website one more time, because this is radio. If you don't say it at least twice, they're not going to get it.
Okay, it's www.ipfh.org.
Okay. Now what I want you to do is talk to the small business people out there that are listening and explain to them why this is good, healthy business, to take a successful business and then start to give back to the community. Talk just a little bit about that, because I think that's really important for them to understand.
Well, obviously we have over 200 folks that live in this area that are our employees. So we want to, and they're on their feet all day working in the factory. And so, interestingly, we make products that protect the foot. And one of the things we found out is that our own employees, a lot of them didn't wear it. So we first thing we did was we tried to we educated the employees and got a lot of them wearing the product. And my father, when this research came out, the light bulb went off, and he said, we've always been a good company and a good corporate citizen. We've always been a member of the Chamber of Commerce. We've always done those things and supported statesville and local events, as a lot of companies do. But this research really had the light bulb go off in his head that, we could be more than a sock company, that made products to make money. We could actually make a contribution to people's health, and of course that includes the local community's health. So we've done any number of things, like sponsored walking trails over at the Anderson Park, and have gotten involved in the Greenway, and done any number of things. But the Institute really had we felt like we needed a not-for-profit in order to take the commercialism taint out of what we were trying to do on the education and awareness part and the research part. And so that's really what the idea behind the Institute was. And we're very gratified to be able to try and make a contribution.
And why haven't you moved those 200 employees overseas? Why have you chosen to stay in Statesville?
Well, it's a family business. We've got roots in the community. And what we've been able to do is been fortunate enough to develop products that can be sold for a high enough margin to be able to keep the manufacturing here. It's very difficult because when I was born, half a century ago or
be
better.
Careful now. You're going to show your age now. Be careful.
Probably 90% of all the socks that were sold in the United States were made within 100 miles of where we're sitting right now. And now less than 10% of those products are made anywhere in the United States.
Right.
And Thorlo and maybe one or two other companies are the only sock brands left in America that are 100% American made. And most of them are coming from China, Mexico, South America, Vietnam. So we've, the whole textile industry, not just the hosiery industry, has been hit very, very hard in the last 20 years especially. And, we've tried to maintain a philosophy to make very high quality products with out of the best materials and deliver them on time and give great customer service and great product design. And you can still make products in America if you can do those things. If you're trying to do commodity products and offer the best price, you can't make them here anymore.
Yeah.
What's of interest to Joe is not only the community involvement, but the fact that you look at your business as something other than just selling something that covers your feet.
Amen.
Which I think is really, really cool.